Hi, my name is Robin Sachs, and I'm a fellowship-trained breast surgeon with BID Plymouth's Breast Center. The purpose of this video is to inform you about the process breast cancer patients goes through from diagnosis to treatment. I'll start with what happens when a radiologist sees something suspicious on a mammogram. The patient will be asked to come back in for additional mammographic views and possibly an ultrasound. A biopsy may be recommended at that time. If the patient confirms a breast cancer, then the patient will meet with a breast surgeon. During this appointment, the diagnosis, surgical options, and medical treatments will be explored in detail. Women typically leave this appointment feeling empowered and educated about their specific breast cancer. Breast cancer treatment is truly individualized, and therefore not every woman will have the same treatment recommendations. We use the input of our multidisciplinary team to develop what the treatment plan will be, as well as the timing and sequence of those treatments. This team includes a surgical, medical, and radiation oncologist, as well as many other supportive staff members. This also includes an oncologist from Beth Israel Deaconess Medical Center in Boston. All breast cancer cases will be discussed either before or after their definitive surgery. Our patients also have the benefit of meeting their team at our multidisciplinary clinic. At this appointment, a patient is able to meet with a medical and radiation oncologist at the breast center. This eliminates the need for multiple appointments, which is beneficial to our very busy patients. Coordinating all of this is our breast nurse navigator. She is specifically trained to help patients through the ins and outs of breast cancer care.
Hi, I'm Kat Melendi, BID Plymouth Nurse Navigator in the Breast Center. As a navigator, I am specially trained to help patients manage the ins and outs of breast cancer care. I'm a member of the team, and I work to bridge the gap between a patient's knowledge of the diagnosis and treatment by providing education, support, and connection to support and wellness resources. BID Plymouth Breast Center has several support groups and wellness activities available to our patients. For example, we have Beat Cancer Boot Camp and Yoga for Cancer Survivors. I can arrange participation in any of these programs. We are here for you during this difficult time, and we have the experience and compassion that every person deserves when confronted with a cancer diagnosis.
The first step in most breast cancer treatment is surgical. There are two options available, either breast conservation or a lumpectomy, or a mastectomy where all breast tissue is removed. Women are offered reconstruction when a mastectomy is performed. Most patients will be able to go home right after their breast procedure. Postoperative care is discussed prior to surgery. If a woman requires support postoperatively, a visiting nurse is arranged prior to surgery. This makes the care seamless and less stressful for the patient. Radiation is another form of local treatment that is offered when a woman has a lumpectomy. Most often, women that have a mastectomy do not require radiation to the breast. Radiation is given every day, Monday through Friday, for 3 to 6 weeks. Appointments last about 20 minutes per day. Radiation treatment uses a unique planning system tailored to your needs. Chemotherapy is prescribed and overseen by the medical oncologist. Education is provided to each patient prior and during treatment to help prevent, manage, or decrease the degree of side effects experienced. Our oncology nurse navigator and nurse practitioners provide a chemotherapy teaching session prior to the start of treatment. The patient receives a calendar of their treatment, prescriptions, literature, and education. They are oriented to the cancer center as to decrease anxiety when they arrive for their first treatment. Other forms of treatment, such as hormone manipulation and targeted therapies, may be offered depending on the specific characteristics of the cancer. It is important to note that some cancer treatments can affect fertility. For women of childbearing age, fertility preservation will be discussed prior to the start of treatment. If a patient is interested in getting a second opinion, we are happy to help arrange that. Often patients will return to BID Plymouth for their actual treatment after having this second opinion because they feel much more comfortable with their care plan. All women diagnosed with breast cancer are assessed by their surgeon to see if genetic testing is appropriate. There is also a geneticist on staff to see patients as well. When a patient comes in for their medical oncology appointment, we are encouraged and welcome them to bring a supportive person with them. It is always helpful to have a second pair of ears. We certainly encourage patients to ask questions and play an active role in their treatment decisions. We hope you found this video helpful. You are in good hands with BID Plymouth's Breast Center staff, and we want you to know that you are our #1 priority.